Hi, everyone. Thank you so much for joining us today. And sticking with us through those couple technical difficulties that we had. So today's presentation, we are really excited for, and I know that a lot of questions will kind of come up with, it's an important topic as we reach kind of the enrollment periods, and then as you get closer to qualifying for Medicaid, sorry. So today we have Carmen with us. She is going to be presenting on everything Medicare 101. So everything you need to know, how to sign up. And so if at any point, whether you are on a mobile device, a computer, or even a tablet, we do have an active Q&A session. So whether you want to put it in our chat or specifically enter your questions into our Q&A portion, just go ahead and enter those there. And then once Carmen is finished with her presentation, we'll go ahead and kind of answer any questions that you have. And so with a great expert with us today, we hope to have a very vibrant Q&A session. So Carmen, I'm going to go ahead and turn it over to you, and we will get started.
Perfect. Okay. Again, thank you for bearing with me. This has been challenging. I'm not very tech savvy as I thought as I was. So thank you. My name is Carmen Cisneros. I've been working for Kaiser Permanente for over 6 years, but I've been helping people with Medicare for over 9 years. A little bit about me, just because I want you to know who I am and I want you to feel comfortable with me personally. I wouldn't call an 800 number and give them my personal information. So here's just something a little bit about me. Again, I work for Kaiser Permanente. I have 11 children. Most people remember me because I'm the woman with 11 children, okay? I am bilingual, so I speak Spanish and English, and I also speak some sign language. So I'm also more fluent in Spanish and English. I've been working with the Hispanic population for many years. I found out that first of all, Medicare 101 is difficult as it is, but if you have that language barrier, it's even more difficult. And for those who want a little bit more information, my phone number is on there. Just because of COVID, I don't do face-to-face visits right now, but we can do a virtual visit. Or you can give me a call. So whatever you feel more comfortable doing, I'm happy to help you any way that you need. Okay, so now let's get started. Okay, who can join Medicare? So if you're 65 or older, okay, you can join Medicare. If you are under 65 and you have a disability, you have to be disabled for 24 months, and then you automatically become eligible for Medicare. Okay. You can have end-stage renal disease and become Medicare eligible, or ALS. What is Medicare? So Medicare is a federally funded health insurance program. It was enacted in 1965, and it's administered by CMS, Centers for Medicare and Medicaid Services. And there's actually 4 moving parts to Medicare. There's Medicare Part A, there's Part B, D, and C. And Part A and B is what we call original Medicare. Okay, now what does Part A cover? That covers inpatient hospital care. It also covers skilled nursing care, hospice care, home health care. What does it cost? For most people, Medicare Part A is called premium free. So if you've worked 10 years, which equals 40 quarters, it costs you nothing. If you have to pay for it, you can pay up to $458. If you're not sure, you call Social Security and they'll let you know if your quarters have been satisfied. And if you are a spouse and you stayed at home taking care of the kid, whether it's a husband or a wife, you can actually get their Social Security benefits. So you don't have to pay that Part A. That is really expensive right now, especially for those on a fixed income. Okay, now Part B. Part B, what does that cover? So that covers your doctors, your labs, x-rays, outpatient services, durable medical equipment. So what durable medical equipment is the oxygen, the CPAP machine, for those who need a prosthesis, that helps with that too, dialysis, preventative services like a colonoscopy, prostate exam, mammogram, a bone density exam. So that's what Part B covers. Now, what does it cost? Okay, in 2020, the standard Part B cost is $144.60. It does go by your taxes. So whatever you paid in taxes in 2020, that is what you pay. So some people pay more, but on average, people pay $144 in 2020. In 2021, that Part B has gone up 6%. It'll now be $153.30. Okay. If you do not get Part B when you're first eligible to, know that there's a couple of things that you should look out for. You could have a penalty. So for every 12-month period, which is every year, you don't get it, you end up paying 10% of that Part B cost. You pay that Part B cost and penalty for the rest of your life. So give me a call and I can walk you through, if you're still employed, and how to make sure you don't pay that penalty. All we have to do is just delay that Part B. Here are some other ways that you can supplement your Medicare coverage. By having original Medicare, okay, you have different options in which way you go. You can enroll in a Medicare Advantage plan, or you can go through a Medigap. Both are really good plans. Both are different. Both serve different needs. A Medigap plan doesn't come with a Part D plan, but a some Medicare Advantage plans do. And again, always make sure you talk it over with whomever you're talking with. Make sure you have at a minimum a Part D plan. So when can you enroll on Medicare Part A and B? Okay. So for those who are receiving Social Security benefits, you automatically get your Medicare card mailed to you. You have a 7-month window when you can enroll. So you can enroll 3 months before your birth month, the month of, and the following 3 months. So 7-month window. If you enroll the 3 months before your birth month, it'll start on your birth month. If you enroll on your birth month, then it'll start the following month. Okay, so we always want to make sure you don't have a lapse in coverage. So it's always best to do it before your birth month. If you did not sign up for the Medicare Part A and the B, and you're wondering, how do you get that Part B? What do you do? How do you do it? Where do you go? So what you do is you go to Social Security website, and there is a fax number. That fax number is going to be your best friend, okay? Because right now, since things are closed, you're going to fax over this Part B form, okay? And the times you can enroll is January 1 through the end of March, and it doesn't become effective until July. So that's one special enrollment period, general enrollment period. The other, we do have other special enrollment periods. If you are currently working and Now you're 70 years old and you want to retire now, and now you need Medicare. So that is a special enrollment period. If I kind of spaced it out, so I'm going to move on. What is not covered by Medicare Part A and B? These are the most commonly asked questions, okay? Long-term care, that is not covered by Medicare. Most dental care. There is some dental care that is covered under Medicare A and B. However, it has to be an extreme case. For example, if you go to the hospital and you need reconstructive surgery in your face, then that's when Medicare will cover, but it will not cover routine services, dentures. It does not cover cosmetic surgery either. Acupuncture or routine healthcare. So for routine foot care, most of the plans out there, they may cover routine foot care now. So make sure you know the ABCs and Ds, ins and outs of the plan that best suits your needs. Okay, now let's talk about the Part D. Part D, think about D for drugs. Covers your prescriptions. You have 3 options on how to get a prescription drug coverage. First, you can enroll in a Medicare Advantage plan that includes a prescription drug plan. You can get a standalone prescription drug coverage plan. Those are offered through a independent healthcare coverage. Or if you are covered by an employer or a union, you could also have a Part D plan that way as well. Now, Part C. That's your Medicare Advantage plan, okay? Medicare Advantage plans combine the Part A, B, and then D to equal Part C. I like to think about C as one complete plan because you have all parts of Medicare and you're not without prescription drug coverage, and it supplements your Medicare A and your B, and it provides you predictable out-of-pocket copays. There is a network that you do have to make sure you follow by. If you choose an out-of-network provider, you may be financially responsible, except in cases of emergency and urgent care services. There are different types of Medicare Advantage plans, than HMOs, than HMO-POS, point of service, preferred provider organizations, PPOs, PFFS. I know, so many acronyms. So make sure that whomever you're speaking with is very well versed to help you with your needs. And for those who need help with their prescriptions, for anybody, for those needing help with their prescription, there is a program called Extra Help, otherwise known as Low Income Subsidy. That helps pay your premiums for your Part D and your copays. So make sure that you are, it is income-based, so make sure that you meet that income requirement before you fill in the paperwork, because they do ask quite a bit of documentation. You can apply through the Social Security website. There's Social Security website, your Medicaid office, or you can also call me and I can walk you through the process as well too. Online in your screen, you see a couple of different other websites to help you find more resources on that Part D, or actually Medicare 101. So this was a really fast Medicare 101. I did have have technical issues, and I do apologize. So if you have any questions, please give me a call. I can walk you through a more comprehensive look at your needs, because everybody's needs are a little bit different.
Awesome. Thank you, Carmen, so much. So we did have a couple questions for you, just kind of covering a little bit about your presentation. So I'll go ahead and jump right in.
Sure.
First question for you, will my Medicare premiums be higher if I make a higher income?
No, just the Part B will be higher, not the premiums. So depending on your income, you just pay more for the Part B, and you may have to pay for a Part D as well.
Okay. So I know you mentioned it a little bit, but do you automatically just get Medicare with Social Security disability benefits, or is that kind of different?
It is a little bit different. So some people on disability, they automatically have the 4 quarters that they need. So then they automatically get the A and B, A for no cost. They do have to pay for the Part B. If they've not satisfied the Medicare quarters, then you might have to pay for that Medicare Part A.
So what happens when not all doctors accept Medicare? So would you have to switch or do something different with my plan?
So depending on your plan, many times certain plans, they may make an exception. So talk to your doctor and see if they will make an exception. If they do, then you're good to go. The referrals have already been made for you. If not, your plan will help you find a suitable provider for you.
Okay. So this question coming from the audience says, I will be working at age 65. So do I need to sign up to avoid a premium penalty? And I will have insurance through my employer while working. So how does that kind of work out?
Great question. So what you want to do is go onto if you have a Social Security account, log on and just let Social Security know that you are going to delay Part B. By delaying Part B, you ensure that in the future, you will not pay that penalty. However, I do encourage you to ask your employer if your employer provides credible coverage.
Okay, so this next one that came in, it says, my husband will be retiring December 31st, but 2021. So hopefully he will need to enroll in his employer's plan by November 15th. So what do you recommend that he does?
So if I understood you correctly, your husband is going to work until next year of December.
Mm-hmm.
Okay. So prior to that, what you want to do is you want to get this form. You can get it online. Give me a call and I'll provide you that form as well. What you want to do with that form is you take it to, your husband takes it to the HR department. They fill it out and they fill out the dates from the day that you were first employed or covered to the very last day that you were covered. So that ensures that you do not have a lapse in coverage and tells Medicare that you had credible coverage. And then you fax it to Social Security, or depending on if you can walk it in, I prefer to walk it in. Always make a copy for yourself because things happen and we're all human.
Right. You never know.
Right.
So we had another question come in. This person is getting a bunch of mail offering the possibility of a free Part C. Is that just an enticement to get a response, or do you think things like that are actually out there?
There are some premium free Part C plans. If you're looking at something like that, I definitely encourage you to look at those, but just so you know, nothing is for free, but there are some premium free. So 0 premium sounds good.
Right.
Yeah.
Awesome. Okay, moving right to the next question. How do I decide whether original Medicare or an Advantage plan? Like which one to choose from? And so how would you compare the Advantage plan?
Well, what I like about an Advantage plan is there is predictable copays, unlike original Medicare does not have predictable copays. Um, Original Medicare has a deductible. Advantage plans, most of them do not. Advantage plans have a maximum out of pocket. So in a calendar year, if you have a tough medical year, you know, if you've met that maximum out of pocket, then anything after that, the health plan pays for that 100%. Unlike original Medicare, it does not have a maximum out of pocket, so the meter just keeps running. So definitely be wary about that for sure.
Great. And then I had another follow-up that came from the question that you did just answer in regards to someone retiring next year in December. So when they want to actually turn in that form, do you have a timeline of when that would be best?
I do. I always tell everybody start working on it 2 months prior, because it can take Social Security up to 60 days to process. So if he is going to retire in December, make sure that you start working in October, start talking to your HR department and have them fill out the form. And then you too have a form to fill out too. Both of those forms have to be sent in at the same time.
Okay. Awesome. Okay, so this next one is coming from Bill in the audience. So I was enrolled in Part A in 2016. After losing a job due to COVID, I was able to enroll in Part B. But what should I do with the Part D with the prescriptions if I don't enroll? Would that be soon? What time should they do that? Yeah, sorry.
That's okay. That's great information. Those are things I would be asking myself. So first of all, what you need to understand is that Part B, when did it become D for drugs? When did that become effective? Okay, because you have a certain time frame to get a Part D plan, because you could also be penalized for not applying for a Part D plan in a timely manner. So it all depends on when you received your Part B for boy.
Okay. Awesome. So I was wondering, Carmen, if you could talk a little bit about the HMO versus the PPO part of the Medicare plan. Because I know one is, outside coverage, one is just kind of staying within your providers, right? So I just wanted to clarify the difference between those.
Great question. So an HMO, they have a network of providers. They work strictly with those providers. A PPO, okay, they have to accept your Medicare assignment. So that just means they have to approve your Medicare, and they have to bill Medicare on your behalf. That's one of the differences. There is a little bit more flexibility with the PPO, but you have to make sure that they accept Medicare assignment and they're going to bill on your behalf. Unlike an HMO, they take care of all of that for you.
Okay. So if you were to travel out of state, or you did on a more normal basis, say, aside from the pandemic or anything like that, would it matter between the two, which you should have, or not really?
For the most part, if it's an emergency situation, it's not going to matter because both plans are going to cover you for urgent care services or hospitalization. What really boils down to is, should you need medical services after hospitalization? Do you need a follow-up care with a doctor, with a specialist? How easy is it to get a referral, or will my insurance cover it? So those are all things to take into consideration.
Okay. So do you have to report a death to Medicare? And if so, how would you go about doing that?
For the most part, they all automatically get notified, but I do encourage you to report them. Just go to the Medicare.gov website. There's an 800 number on there, or usually on the back of your Medicare card, there is an 800 number on there. Just give them a quick call.
Okay.
And then if they are enrolled in a Medicare supplement or Medicare Advantage, they are automatically notified as well too.
Okay. So does Medicare cover any of the costs associated with a funeral or kind of funeral arrangements or anything like that?
Unfortunately, it does not. That falls back onto the family members.
Okay, great. So we had another question. What does primary and secondary insurance mean in relation to Medicare?
Okay. So primary means it pays first. And then secondary, it just means it picks up the rest. So depending on what type of a plan that you are thinking of or are enrolled in, the copays could be different because primary could only pick up a portion of it, and then the secondary could pick up the rest. So in a nutshell, that's what it means.
Okay, great. I just want to double check that I haven't missed anybody's questions here.
Of course.
Awesome. Yeah, I think let's see. Oh, we had another follow-up too from the scenario of how somebody was enrolled in Part A and then due to COVID and their jobs scenario. So they enrolled in Part A in 2016 and recently Part B in 2019 to 2020. I believe that's what that says. Are you aware of the time period it takes to enroll into Part B?
Can you repeat that again, Lindsay?
Yeah.
Because I'm a little confused.
So it says
Part A in 16,
yes,
right?
Part A in 2016 and recently Part B in 2020. So I think I'm not sure.
Okay.
Are you able to chat, Bill, and say what month for Carmen so she has a better idea?
He can call me too.
Okay, great.
Directly,
great.
yeah.
So yeah, we'll say that just because, sorry.
And usually if he enrolls like in a Medicare Advantage plan and he's eligible right now, it usually starts the first of the following month. Just something unique about Kaiser Permanente is they are a 5-star plan. They do provide a Part D plan. So anybody needing Medicare right now, they can enroll this month and it'll be effective the first of the following month. We are going through the open enrollment period right now. So if you enroll in a Part D plan right now, it may not start until the first of the year. But until you and I get a little bit more information from each other, I cannot be very specific.
Okay, great. So Carmen, what I wanted to do also really quick is for anybody, because I know we kind of jumped into the question and answer portion. So I wanted to give people the opportunity to just kind of grab your contact information. So I'm going to do that really quick.
Thank you, Lindsay.
Okay. Okay, am I on the correct slide, Carmen?
Yes, yep.
Okay,
so,
great.
Yeah, they could actually email me, Carmen.t for Teresa .cisneros@kp.org, or they can give me a call, or they can even text me. I have a lot of people texting me that number, 970-518-5329.
Perfect. And then I'll just leave that up really quick so that people can kind of grab a pen and paper and write it down. But I think that's all of the questions that we had come through. That's all of the questions that I had, Carmen. And so thank you so much. I know it's kind of it's a topic that a lot of people, I think it sneaks up on you, right? You think you're prepared. And then at the same time, there are a lot of different aspects as far as, what plans and all the different parts. So thank you so much.
Well, you're welcome. And it does change from year to year. So it is important to talk to somebody locally who knows the ins and outs and what plans are out there. And also talk to them about your health needs, your wants, and your needs. And I specify needs, again, I emphasize needs because my needs are very different than anybody else's needs. So again, I'd rather call somebody who's local instead of an 800 number, and I just can't, I'll never talk to that person again.
Yeah, absolutely. So for this webinar, it is accessible again on our website, as well as all of the information that Carmen shared about how to contact her and a little bit more information even about Kaiser Permanente, you can find on the website as well. So that URL specifically is www.northerncolorado55better.com. And so in case you missed the slide at the beginning, or even when we just shared it now, you'll be able to have Carmen's contact info. Check out the chat. We did post it there for everybody. But otherwise, thank you so much again, one more time, Carmen. We appreciate your time, and we'll be back on Monday, same time, same channel.
Thank you, Lindsay, and thank you everybody for the great questions.